You think a tiny pill can't hurt you, but it might be stealing years of life. Every day, millions of adults over 65 swallow medicines that should help them, yet many of those drugs are hidden time bombs. Stay with me for the next 15 minutes and I'll reveal the 5 medicines I would never let my own parents or grandparents take, and what you can do right now to protect them. Last year, my 78-year-old mother was prescribed a sleep aid for her aching knees. Within weeks, she was dizzy, confused, and ended up in the emergency room. Seniors are especially vulnerable because the body's metabolism slows down, chronic conditions pile up, and the kidneys lose up to half of their clearance power after 65. That perfect storm turns a harmless-looking tablet into a silent threat. Our goal today is simple. We'll identify each risky drug, understand the basic biology behind the danger, and give you a concrete step you can take today. Let's begin with the first medication most people never suspect. The first culprit is the class of calming pills known as benzodiazepines, think Xanax or Valium. They are prescribed for anxiety or insomnia because they work fast and feel safe. In older adults, however, the brain's GABA receptors become oversensitive. The result is excessive sedation and impaired balance, which is the leading cause of falls in this age group. A single dose can tip the scales from steady to shaky in minutes. If you hear a loved one wobbling after a night of just a little pill, ask yourself, would you let them stumble because of a tiny tablet? Here's what you can do. Talk to the prescribing doctor and request a non-benzodiazepine sleep aid, or explore cognitive behavioral therapy for insomnia, which has no chemical side effects. If the drug is already on the shelf, schedule a medication review every 3 months with a pharmacist who specializes in geriatric care. A quick check can reveal safer alternatives and prevent that dangerous sedative buildup. Now let's move to a drug that hides in the kitchen cabinet, the over-the-counter painkillers called non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen. We reach for them for aches, arthritis, and headaches, assuming they are harmless because they're sold without a prescription. The biology tells a different story. NSAIDs block prostaglandins, which not only mediate pain, but also protect the stomach lining and keep blood flowing through the kidneys. In seniors, reduced kidney blood flow combined with a fragile stomach lining can trigger chronic gastritis, stomach ulcers, and even acute kidney injury. Imagine a tiny tablet quietly eroding the protective barrier of the gut while the kidneys struggle to filter waste. That's a recipe for hidden damage. The practical advice is straightforward. First, limit NSAID use to the lowest effective dose for the shortest possible time. Second, consider acetaminophen for mild pain, but check the label for liver safety limits. Third, if an NSAID is essential, ask the doctor for a gastroprotective agent like a low-dose proton pump inhibitor, and ensure regular kidney function tests are part of the routine. A simple switch to a safer pain management plan can preserve both stomach and kidney health. Next on the list is a medication that many seniors take for heart rhythm control, the class of drugs called digoxin. It has been a staple for atrial fibrillation for decades, but its safety window narrows dramatically with age. The heart cells rely on sodium-potassium pumps that become less efficient after 65, and the kidneys clear digoxin more slowly. The consequence is a heightened risk of toxicity, which can manifest as nausea, visual disturbances, and dangerous arrhythmias. 1 extra milligram in an older body can tip the balance from therapeutic to poisonous. What should you do if digoxin is on the medication list? First, ask the cardiologist whether the dosage can be reduced or if an alternative antiarrhythmic with a wider safety margin is available. Second, request regular blood level monitoring. A simple blood test every few weeks can catch rising levels before symptoms appear. Third, be vigilant for subtle signs, loss of appetite, yellow-green vision, or unusual fatigue. Promptly reporting these to a healthcare provider can prevent a crisis. These 3 medicines, benzodiazepines, NSAIDs, and digoxin, illustrate how a pill that seems helpful can become a hidden hazard when the body ages. What do you think about these risks? Share your thoughts in the comments. I really want to hear your perspective. If this information is opening your eyes, give the video a like. It tells the algorithm that we're helping seniors together. And if you're finding this valuable, hit that subscribe button so we can keep exploring the secrets that protect our loved ones. Now let's turn our attention to the 4th medication, a common blood pressure drug that many seniors assume is harmless. But why does an agent that is meant to safeguard the heart become a hidden danger in an older body? The answer lies in the way our bodies change after 65. Number 6, the kidneys, which act as the body's natural filtration system, lose a portion of their functional units, the glomeruli, and the overall blood flow to these organs declines. At the same time, the delicate balance of electrolytes, especially potassium, becomes more fragile. When an ACE inhibitor blocks the conversion of angiotensin I to angiotensin II, it also reduces the production of aldosterone, the hormone that tells the kidneys to excrete potassium. In a younger, robust kidney, this shift is easily managed, but in an older adult, the same reduction can lead to a slow, insidious buildup of potassium in the bloodstream, a condition known as hyperkalemia. Hyperkalemia is more than a laboratory number. It can manifest as muscle weakness, a feeling of heaviness, or in severe cases, life-threatening heart rhythm disturbances. In addition, ACE inhibitors can cause a dry, persistent cough in a noticeable proportion of patients. That cough is not just an annoyance. It can disrupt sleep, lead to chronic throat irritation, and in some cases mask the early signs of a more serious respiratory issue. And because the drug also lowers the pressure within the tiny blood vessels of the kidneys, a sudden drop in blood pressure, for example, when standing up quickly, can tip an older adult into a state of reduced kidney perfusion, further impairing the organ's ability to clear waste and electrolytes. Pause. So what can you do if an ACE inhibitor appears on your loved one's medication list? First, ask the prescribing physician whether a lower dose might achieve the same blood pressure benefit while reducing the strain on the kidneys. In many cases, a modest reduction is enough to keep the drug safe. Second, request regular monitoring of kidney function and serum potassium. A simple blood test every 3 to 6 months can reveal early trends before symptoms appear. Third, be vigilant for the subtle signs of excess potassium, a sense of fatigue that does not improve with rest, occasional palpitations, or muscle cramps that seem out of proportion to activity. If any of these emerge, bring them to the doctor's attention promptly. Another practical step is to review any over-the-counter medications that might be taken alongside the ACE inhibitor. Non-steroidal anti-inflammatory drugs, for instance, can further reduce kidney blood flow and amplify the risk of hyperkalemia. If pain relief is needed, discuss alternatives such as acetaminophen or topical agents that do not interfere with renal function. Finally, if the dry cough becomes a persistent nuisance, ask whether an angiotensin II receptor blocker, a drug in the same family but with a lower incidence of cough, might be a suitable substitute. Now that we have uncovered the hidden risks of ACE inhibitors, let's move on to the fifth and final medication on our list, a drug that often hides in the nightstand drawer, promising sweet dreams but delivering a cascade of unwanted side effects. I am referring to first-generation antihistamines, the classic over-the-counter sleep aids that contain diphenhydramine, chlorpheniramine, or doxylamine. You may have seen these labeled as nighttime allergy relief or sleep aid, and they are marketed as harmless solutions for occasional insomnia or seasonal allergies. Why do these medications seem so appealing? The answer is simple. They are inexpensive, widely available, and they produce a noticeable sedative effect within minutes. For someone who struggles to fall asleep, the promise of a quick, reliable knockout pill can be very tempting. Yet the very mechanism that makes them drowsy also makes them risky for older adults. First-generation antihistamines are potent anticholinergic agents. They block the action of acetylcholine, a neurotransmitter that plays a crucial role in memory, attention, and the coordination of muscle movement. In a younger brain, the nervous system can often compensate for this blockade, but in an older brain, the reserve is limited. The result can be a constellation of symptoms collectively known as anticholinergic burden, confusion, difficulty concentrating, memory lapses, and an increased risk of falls due to impaired balance. Moreover, these drugs dry out the mouth, leading to difficulty swallowing and an elevated risk of dental decay. They also slow gastrointestinal motility, which can cause constipation, a problem that is already common in seniors and can lead to discomfort and even bowel obstruction if left unchecked. Perhaps the most concerning long-term consequence is the growing body of research linking chronic anticholinergic exposure to an accelerated decline in cognitive function and a higher incidence of dementia. The evidence suggests that even occasional use of diphenhydramine can contribute to a measurable reduction in cognitive performance over time. In the context of an aging brain, that reduction may be the difference between maintaining independence and requiring assisted living. Pause. So how should you respond when you see diphenhydramine or a similar first-generation antihistamine on a medication list? The first step is to ask whether the medication is truly necessary. For occasional allergy symptoms, a second-generation antihistamine such as loratadine or cetirizine can provide relief without the heavy anticholinergic load. For sleep disturbances, consider non-pharmacologic approaches that have proven effectiveness. Establishing a consistent bedtime routine, limiting caffeine and screen exposure in the evening, and incorporating mild physical activity earlier in the day. If a medication is still required, a low-dose melatonin supplement taken under the guidance of a healthcare professional may offer a gentler alternative for promoting sleep. If the over-the-counter sleep aid is already being used nightly, discuss a gradual taper with the prescribing clinician. Sudden cessation can lead to rebound insomnia, but a slow reduction allows the body to adjust without abrupt withdrawal. Throughout this process, keep a symptom journal. Note the exact time the medication is taken, any side effects observed, and any changes in sleep quality or daytime alertness. This record can be an invaluable tool for the doctor when deciding whether to discontinue or replace the drug. Now that we have explored all 5 medications, benzodiazepines, nonsteroidal anti-inflammatory drugs, digoxin, angiotensin-converting enzyme inhibitors, and first-generation antihistamines, let's take a moment to reflect on the common thread that ties them together. Each of these drugs in isolation offers a clear therapeutic benefit. Yet when they intersect with the physiological changes that accompany aging, slower metabolism, diminished renal clearance, altered receptor sensitivity, and a more fragile cognitive reserve, the balance can tip from benefit to harm. What practical steps can you take right now to protect the health of the seniors in your life? First, compile a complete, up-to-date medication list that includes every prescription, over-the-counter product, and herbal supplement. Bring this list to each medical appointment and ask the clinician to review it for potential drug-drug interactions or unnecessary duplications. Second, schedule regular medication reviews with a pharmacist or a geriatric specialist. These professionals are trained to spot high-risk combinations and can often suggest safer alternatives. Third, be proactive about monitoring. Simple lab tests, kidney function panels, electrolyte checks, and, when appropriate, drug level measurements can catch problems before they become emergencies. Fourth, educate yourself about the warning signs of each medication's toxicity: sudden dizziness, unexplained fatigue, changes in mental clarity, persistent cough, or unexplained bruising. When any of these appear, reach out to a healthcare provider promptly. Fifth, encourage lifestyle measures that can reduce reliance on medication altogether. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains supports cardiovascular health and can lower blood pressure readings naturally. Regular, moderate exercise, even a daily walk around the neighborhood, improves circulation, strengthens muscles, and enhances balance, reducing the risk of falls that many of these drugs can exacerbate. Adequate hydration, good sleep hygiene, and stress reduction techniques such as mindfulness or gentle yoga can further diminish the need for pharmacologic intervention. Pause. I want to hear from you now. Have you or a loved one experienced any of the side effects we discussed today? Which of these 5 medications have you found to be a hidden hazard, and how did you navigate the conversation with your doctor? Share your stories in the comments below. Your experience might be the key that helps another viewer avoid a dangerous pitfall. If the information you've heard so far has opened your eyes to the subtle ways that common medicines can undermine senior health, please give this video a quick thumbs up. That simple click tells the platform that we are delivering valuable, life-saving content, and it helps more families discover these essential insights. And if you haven't already, consider subscribing and tapping the notification bell so you won't miss the next episode, where we dive deeper into practical strategies for safe medication management, from de-prescribing techniques to creating a personalized health track journal. Before we close, let's recap the 5 medicines we highlighted, along with the key actions you can take for each. Benzodiazepines, avoid them for sleep or anxiety whenever possible. Explore cognitive behavioral therapies and discuss dose reductions with the prescriber. Monitor for falls and excessive sedation. Nonsteroidal anti-inflammatory drugs, limit use to the lowest effective dose for the shortest duration. Pair with a gastroprotective agent if absolutely necessary. Ensure regular kidney function testing. Digoxin, verify that dosing is appropriate for the individual's kidney function. Schedule routine blood level checks. Stay alert for visual disturbances, nausea, or unexplained fatigue. Angiotensin-converting enzyme inhibitors, request periodic kidney and potassium monitoring. Consider dose adjustments or alternative agents if a persistent cough develops. Avoid concurrent NSAID use without medical supervision. First-generation antihistamines, replace with second-generation antihistamines for allergy relief. Pursue non-pharmacologic sleep strategies or melatonin under guidance. Keep a symptom diary when tapering off. By taking these steps, you empower your loved ones to stay in control of their health, reduce the risk of adverse drug events, and maintain a higher quality of life well into their golden years. Remember, the goal isn't to create fear, but to foster awareness. Knowledge is the most powerful tool we have in the fight against medication-related complications. When you understand how each pill interacts with an aging body, you can make informed decisions, ask the right questions, and advocate effectively for safer treatment plans. Thank you for spending this time with me. I appreciate your dedication to protecting the seniors you love. Until next time, stay curious, stay compassionate, and keep striving for healthier, happier lives.